Welcome to Dr. Mateo. Health, prevention, wellness.
Hello, I'm Dr. Mateo. If you are over the age of 60, I want you to stop whatever you're doing for just a few minutes and listen closely. I've spent years sitting across from patients who tell me the same thing. I thought it was just part of getting older. They talk about a little tingling in their toes, a bit of morning blurriness in their eyes, or waking up with a mouth as dry as a desert, and they dismiss it. But I'm here to tell you the truth that many doctors don't have time to explain in a 15-minute appointment. Your body does not whisper, it screams. Those small, annoying sensations are actually SOS signals, biological alarm bells telling you that your nerves are starving, your arteries are stiffening, or your brain is under attack. Today, I'm going to walk you through the symptoms that should never be ignored. We're going to look at what's happening deep inside your cells, and most importantly, I'm going to give you the natural, science-backed tools to fight back and reclaim your independence. 1. The electrical warning in your feet. The very first place your body often speaks up is your feet. Many of my patients describe a tingling, pins and needles feeling, or a sensation like they are walking on a crumpled sock even when they are barefoot. Think of your nerves like electrical wires. Every wire has a plastic coating, the myelin sheath, that allows signals to travel cleanly from your brain to your feet. When blood sugar stays high, it acts like an acid, slowly eating through that insulation. That sparking you feel as tingling is literally electricity leaking out of your nerves. If this progresses, it turns into a burning sensation, often worse at night when you're trying to sleep. This happens because the sugar rust in your blood, technically called advanced glycation end products, gums up the tiny blood vessels that feed your nerves. Your nerves are suffocating, gasping for air, and they send a panic signal to your brain that you interpret as fire. The solution: you must give your body the building blocks to repair that insulation. I recommend a specialized, fat-soluble form of vitamin B1 called benfotiamine. Unlike regular B1, which just washes out of your system, benfotiamine soaks into the fatty nerve tissue like oil into cracked leather, scrubbing away the toxic sugar byproducts. Pair it with methylcobalamin, the active form of B12, to help rebuild that myelin coating. 2. The truth about your aging eyes. Do you wake up with blurry vision that takes an hour to clear? Or perhaps you've noticed that headlights at night now look like exploding starbursts. Most people assume this is just old eyes, but it's often a structural collapse caused by a deficiency in a molecule called glutathione. Your lens loses its primary antioxidant defense at a rate of roughly 8% every year after age 60. Without glutathione, the proteins in your lens clump together and turn cloudy. That's the beginning of a cataract. Furthermore, glycation, that same sugar damage we talked about with nerves, is happening in your eyes while you sleep. The solution: you can actually force your body to restore glutathione production. The most powerful tool I found in the research is a simple morning protocol: 1 ounce of raw sunflower seeds, a quarter of an avocado, in the juice of half a lemon. Here's why it works. Sunflower seeds are packed with vitamin E, the master protector of your lens. The avocado provides the healthy fats needed to absorb that vitamin E. And the lemon provides vitamin C, which actually recharges the vitamin E so it can keep working for hours. It's a self-renewing antioxidant system for your eyes. 3. The red flag in the bathroom. I know nobody likes to talk about it, but your stool is a report card for your internal health. There is one specific type of stool that is an absolute emergency: black, tarry, or sticky stool that looks like coffee grounds. This usually means you're bleeding somewhere in your upper digestive tract. Blood turns black as it sits in your intestines. If you see this, do not wait. It could be an ulcer or even a sign of cancer, and it requires an immediate trip to the emergency room. Another sign is pencil-thin stool. If your stool is suddenly thin and stays that way for more than a couple of days, it means something is physically squeezing the path, possibly a tumor. The solution: to protect your gut, you must feed the army of good bacteria inside you. Eat half a cup of plain yogurt with live cultures daily and feed those bacteria with prebiotics like slightly green bananas, which contain resistant starch that supports your colon. 4. The silent danger of a dry mouth. If you wake up and your mouth feels like it's full of sawdust, you might think you just need a glass of water. But for seniors, chronic dry mouth, or xerostomia, is a major risk factor for aspiration pneumonia. Saliva isn't just spit, it's a sophisticated biological defense fluid packed with antimicrobial compounds. Without enough of it, bacteria establish colonies in your mouth. When you swallow with a dry mouth, the lack of lubrication makes it easier for food or contaminated saliva to be inhaled into your lungs instead of going down your esophagus. This is a leading cause of hospitalization for those over 65. The solution: check your medications. Over 500 common drugs, including blood pressure pills and antidepressants, cause dry mouth. Drink water strategically using the WTR protocol. 12 ounces of room temperature water with a few drops of trace minerals immediately upon waking to rehydrate your blood and cells. 5. Why you feel dizzy when standing. Have you ever stood up quickly and felt the room tilt? Your doctor might tell you your blood pressure is perfect at 120/80, but that number might actually be too low for you. As we age, our arteries stiffen and our baroreceptors, the sensors that adjust pressure when we stand, become sluggish. If your baseline is too low, your brain doesn't get enough blood when you stand up, leading to orthostatic hypotension in devastating falls. Research shows that for many seniors over 75, a systolic range of 130 to 145 is actually associated with the longest survival and best cognitive function. The solution: perform the orthostatic test at home. Check your pressure while lying down, then stand up and check it immediately. If it drops by more than 20 points, your medication may be too aggressive. To naturally improve the pipes of your circulatory system, try isometric hand grip training. Squeeze a grip device for 2 minutes, rest for 1, and repeat. This stimulates the production of nitric oxide, which helps your vessels relax and stay flexible. 6. Cold hands, cold feet, and the syrup effect. If your hands and feet are always freezing, even in a warm room, your circulation is struggling. Your blood is acting more like thick maple syrup more than a flowing river. This often happens because your body's production of nitric oxide drops by 50% after age 60. The solution: you can grease the pipes with a circulation elixir. Blend half a cup of raw beets, which are loaded with nitrates, fresh ginger, and a teaspoon of turmeric. Beets provide the raw materials for nitric oxide. Ginger reduces inflammation in the vessel walls, and turmeric prevents your blood platelets from sticking together. Drink this in the morning and follow it with 5 minutes of light movement, like marching in place, to spark the circulation boost. 7. The medicine cabinet trap. Finally, I want to talk about brain fog and memory loss. Many seniors are terrified of dementia, but the root cause might not be age, it might be your pills. Common medications like PPIs for heartburn, Prilose and Nexium, and statins for cholesterol can interfere with the very nutrients your brain needs. PPIs block the absorption of vitamin B12, which is the master electrician that protects your brain tissue. Without B12, your nerves literally strip their own insulation away. The solution: if you are on these medications, you must supplement with methylcobalamin B12. Under the tongue is best for absorption. Also, consider the nutrient timing reset. Take your vitamin D3 and K2 in the morning with a fatty meal like eggs to ensure calcium goes to your bones. Take your magnesium glycinate at night to calm your nervous system and prevent those agonizing nighttime leg cramps. I want to be very clear with you. You are the CEO of your own health. If you are experiencing any of these symptoms, do not let anyone tell you it's just age. Your body is giving you a chance to intervene before the damage becomes permanent. Start tomorrow morning. Look at your feet, check your stool, try the sunflower seed protocol or the circulation drink. Small, consistent changes are what actually move the needle over time. If this information made sense to you, please share this video with a friend or a spouse who needs to hear it, and leave a comment below. Tell me your age and which of these symptoms you've been noticing. I read every single one, and we are building a community of people who refuse to accept decline as inevitable. I'm Dr. Mateo. Take care of yourselves, pay attention to the signals, and I'll see you in the next consultation.